Association's DSM, and that's currently on DSM-4, and that's used throughout North America. And then Europe and the rest of the world has sort of classic ICD-10 codes that we assign to diagnose mental health. These systems used to be a lot more different, but now actually they've been the last sort of iterations of them. They're very similar to look at, and they should give similar disorders according to the symptoms. So this is the latest version of DSM-4. And what we're really going to talk about today in terms of the evidence I'm going to discuss are these disorders up here. So we're going to look at things like schizophrenia, depressive disorders and anxiety disorders. These are the ones that are typically been looked at. Depression and anxiety are terribly common, and I think intuitively we think if you live in a poor environment, it might make you feel depressed, or it might make you anxious if you felt it wasn't a safe environment. And there's some interesting work being done on schizophrenia looking at the urban environment, so I'm going to talk a little bit about that later. So just to talk briefly about sort of models of mental health, as I said earlier, they've got really complicated etiologies. And really the accepted model these days is the Biopsychosocial model, which is described here. And so this model brings together various vulnerability factors that we think will determine whether you experience poor mental health. So there's the sort of more obvious biological factors, your genetic disposition, also whether you've had a physical illness. Lots of depression, for example, might be triggered by experiencing poor physical health. Then there's what we refer to as the psychological factors. So, for example, having a poor childhood, experiencing adversity. It's when you learn sort of the maladaptive responses. And then finally, the social environmental factors, which covers things like your exposure to socioeconomic stress, the quality of your relationships, social support, and the quality of your physical environment. Now, this model is intended to bring together many strands of things that we know influence illnesses like depression and anxiety. But I think it's important to realise that the boundaries between these things are a little bit superficial. So, for example, people who've got lower socioeconomic status are more likely to experience physical ill health anyway. So that sort of gives you two things that might be causing the illness. And then I'm sure you're aware of the stress diathesis model, which is part of this model. So the diathesis refers to your sort of individual biological vulnerability to having a mental disorder. And then stress is any event or condition which might sort of interact with your biological vulnerability to influence your risk. It's generally thought, although I'm not entirely convinced, that if an individual has lower biological vulnerability, they need more stress to trigger the disorder. Whereas if you've got a high biological vulnerability, it's thought that you probably need less stress. So there's thought to be some sort of individual difference there. And just really, I've had to put this slide up and quickly spoken about it because it is the dominant model of mental health really within the field. And so just coming back to why I think it might be quite difficult to see effects of the environment on mental health. This next slide talks a little bit about socioeconomic status. And the thing with things like depression and anxiety is there's often a social gradient in the rates of these disorders across different socioeconomic groups. So if you've got greater socioeconomic disadvantage, you've got a higher risk of having certain disorders. So this graph's taken from a 27-year follow-up of a Finnish study. And along the side here, we've got the mean number of depressive symptoms they reported across 4 different measurement phases. And as you can see, the top line here is those who've got the lowest socio-economic status. The green one there is the middle, and then down the bottom here is the highest socio-economic status. And what you can see is that at each phase, those who've got low socio-economic status are reporting a higher number of mean depressive symptoms. And then you've got a nice dose response with the average people in the middle and the highest socioeconomic status having the lowest number of symptoms. As lots of studies have looked at this and show these sorts of gradients in mental disorders. But I'm hoping just to highlight that when you start to then think about the physical environment as well and mental health, you've already got this huge social gradient. And so why do we think there are social gradients in rates of disorder? Well, one explanation is social drift. The idea here is that people become mentally ill and that makes them drift, as we say, or makes them less socioeconomically successful. So, for example, if you get very bad depression, you might be unable to work, or you might not be able to work in such a good, demanding job. And so the idea here is that the mental health problems come before your decline in socioeconomic status. In comparison, the social causation model suggests that it's the socioeconomic status itself, having a sort of a lower socioeconomic status, lead you to sort of developing poor mental health. And the reason for this is that lower socioeconomic status is thought to be associated with greater exposure to stress. And then finally, there's a lack of resources model, and this says that it's actually when you're at a lower social disadvantage, you've got fewer resources open to you to help you cope with stresses when they come along. And so having fewer economic, psychological, or social resources leads to you developing poorer mental health. So in this model, it's the lack of resources is seen to have a direct effect on your mental health. So that was just a sort of quick look at mental health. I appreciate it's been quite quick, but I'm going to come on now to talking a bit about the physical environment. And a few years ago, I was asked by the Mental Health Foundation to do a systematic review of the field of the physical environment and mental health. And I think when we started this, we thought, goodness, physical environment's actually quite a vague term in terms of what it might cover. So some of the things that we did look at, and this slide is by no means exhaustive, so we looked for papers that looked at like neighbourhood spatial density. So if you've got a higher density population, how does that affect your mental health? Things like perceived safety in the neighbourhood. It's good evidence to show that that influences how your mental health is. Maintenance, how well maintained is your environment? There's the classic idea that if no one looks after the environment, it actually just gets worse and worse, and that we were interested in papers that might have looked at that aspect. Access to green space, which back when we did the review, which was back in 2007, I don't think that was quite as popular as it is now. I think in the last few years there's really been a lot of good evidence coming forward for that. Noise, of course, which I'm going to talk a little bit about later. Traffic level, air pollution, and again, I think in the last 7 years or so, there's been a huge increase in number of air pollution papers as well. Things like crowding in the home, I'm interested in. They're both a sort of socio-economic marker, but also there might be a physical effect of that on your mental health. Housing tenure, so again, this shares a socio-economic aspect. Do you rent your house? And how does that relate to your mental health? Housing quality, community facilities, and exposure to violence in the neighbourhood. We found quite a few American studies that were looking at that. And so before I come on just talking a bit more about that review, think about how might the environment influence mental health. So what might the mechanisms be that link together the environment that you live in and how it might influence your mental health? So there's been quite a few theories put forward. Probably the most prevalent is that if you live in a poor environment leads to stress, and that leads to the sort of classic physiological changes. So stress-related hormones, norepinephrine, things like that, that then actually lead to you getting a physiological stress response. Also, stress is a psychological response. So rather than the physiological type of stress, there's also a pathway through psychological stress. If you live in a poor environment, for example, you don't feel safe to go out, or you don't want to go out, it might have an influence on your social networks and the social support that you have within your neighbourhood or your area. There's also other ways that I think often overlooked. So, for example, we could probably all think of an area that you'd say, oh, that's a bad area. I wouldn't want to come from there, or people don't want to admit they live there. And we're probably all, you're all sort of smiling at each other, but we all know that every city has these areas that people don't want to go into. But of course, some people live in these places and they do experience prejudice when they tell people where they're from. So this sort of weighs through an effect on their identity in a way, because you all feel that you like to feel that you belong in a place, or where you grew up is part of who you are. And so there's a pathway there. And then finally, and I'm not going to talk about it much today, but the whole action of the planning process can be hugely stressful. I don't know how it is here in Canada, but you can have, in the UK, you can have long drawn out planning applications. So somebody wants to build, say, a wind farm. You don't want the wind farm near your house. It becomes a huge sort of stressor in your life. And so there can be this very direct pathway that you might develop, say, depression in response to an event, a planning event like that. And I think it's interesting to note that these sort of mechanisms based on the environment having an influence both at the individual level, so for example, does it increase your cortisol levels, and also at the sort of household, community and area level. And so just to quickly talk a little bit more about this sort of physiological stress, it's thought that chronic exposure to stress causes prolonged activation of endocrine and catecholamine. And so things like catecholamines can lead to you developing atherosclerosis and other cardiovascular outcomes. And if you've got elevated epinephrine or norepinephrine, this can actually affect your mood and your behaviour directly. So there's actually a direct link between having higher levels of those and you actually feeling depressed symptoms. So there's a biological reason there that you might have a stress response. And so, for example, children from neighbourhoods who've got high environmental noise levels, they tend to have more physiological stress symptoms in comparison with children from quieter areas. So there is evidence that these sort of physiological reactions are going on. In terms of psychological stress responses, and this slide mainly deals with children, but it's true for adults too. I mean, children are thought generally to be more vulnerable to the effects of environmental stresses. They're likely to be quite poor at appraising threats within their environment, and also they just might not feel they've got such well-developed coping strategies as adults. And I think learned helplessness is really interesting. This is the idea that individuals who don't perceive themselves to be in control of their environment can become very demotivated. So if you don't think you can have an influence on your environment, you tend to sort of stop trying to have an influence on it, and you can become very demotivated. And so this is another mechanism that I think has a lot of relevance in this field. And so I spoke a little bit before just about social support, and I just wanted to talk about it a little bit more. I mean, social support is really increasing evidence for the importance of social support, both for your physical health and for your mental health. And again, it sounds really intuitive, but actually if you could improve people's social support, you'd really be having quite a good impact on their mental and their physical health. And there's several different types of social support that have been looked at. There's a sort of more classic, what we probably think of as emotional support. Do you have somebody to talk to? Is there somebody there if you've got a problem that you can have a talk through? There's also other things. So, for example, there's a thing called tangible support. And so this is often said to be sort of financial assistance. And a question we often put in community surveys in the UK is, you know, if you needed £100 or say $100, would you have somebody you could go to and ask to borrow that money from? And these sorts of social support are actually really important for your mental health. So this is the slide from a national mental health survey that I was involved in. And basically we got people to rate how much social support they had at home and also how much they had at work, there in red. And up the side here is the odds ratio for having a depression or anxiety disorder. So this isn't symptoms, this is actually having what we would think of as psychiatrists as a treatable disorder that we would want to have you in treatment. And so those people who said they had high social support at home, at work, you can see as support goes down, the odds for you having depression or anxiety goes up. You can see that was true for those Even people who've got mid-levels of social support, they've got a higher risk compared to those who've got high support. I mean, this data I've given you here is cross-sectional, but there's also longitudinal studies that show the same effect. If you looked at social support now and your odds of having a depression in, say, 5 years' time, you would see exactly the same pattern. So coming back to the systematic review, this is published, as I said, it's probably a little bit out of date now, but I think it gives a good overview of the field back then. So this was done using systematic review methodology. We searched lots of different databases from the start of 1990, generally up to 2005. So overall, we identified 147 papers, and of those, 99 were included in the review after we had a further look through them. And the papers that we found actually covered these areas, so things like access to green or open space, neighbourhood violence, housing and neighbourhood regeneration, housing tenure, neighbourhood disorder, noise, population density, neighbourhood population density and urbanicity. And when we looked at these studies, we were trying to find studies that have got good measures of mental health, and often the studies don't have good, what we would think of in psychiatry as a good measure of mental health. So most of the studies we found did have what we call symptom scales, so things like the General Health Questionnaire or the short form 36. So these are okay measures of sort of symptoms of depression or anxiety, but they're not what we would think of as medical diagnoses, so they're not ICD-10 diagnoses of these disorders. And the most frequent outcomes we saw was general psychological well-being, depression, anxiety, schizophrenia and suicide. So just a few highlights from the review that I'm going to go through quickly. There was really good longitudinal evidence of an association between being born in an urban area and schizophrenia, with most studies identifying increasing gradient of risk with increasing urbanicity. So there's some really nice studies out there that also take, they track across the life. So they don't only look at whether you were born in an urban or a rural area, they also look at where you moved to as an adult. And you see this nice dose response. So the highest risks for those who were born in an urban area and stay in an urban area, and the lowest for those who were born in rural and stay in the rural. And there was good cross-sectional evidence that living in more sparsely populated areas, so areas with low population density, is associated with the higher rates of suicide in males. However, the evidence for the females was not clear, it wasn't strong, there was mixed evidence there. But I think that probably fits with what we think of as rural areas and sort of male suicide patterns. There was longitudinal evidence of an association between housing or neighbourhood regeneration and mental health. However, when you actually start to look at these studies, they're not methodologically very strong, a lot of these studies. So although we could say there's evidence, a lot of them have really low response rates. So response rates say less than 25%, and so you do start to worry about the bias. We're pretty much sure that people who experience depression symptoms, things like that, are probably less likely to take part in the survey anyway, and so you start to worry a little bit about the bias. There wasn't really good evidence that population density was associated with schizophrenia or with sort of psychological distress or depression. And back then, it's probably a bit different now, cross-sectional evidence that access to green space was associated with better mental health. We did have evidence for that, but again, there was quite low response rates. And I think these days with GIS, you can do much better measurements actually of people's access to green space. These studies back then were based on people just reporting if they had a garden or if they went to the park and things like that. And again, that highlights some of the problems with these studies, is how well you can actually measure exposure in population surveys like this. So I'm going to just briefly talk to you about a study we're looking at housing and neighbourhood regeneration in London. So from the evidence I'll skip that. We did find some longitudinal evidence for effective regeneration, but we thought it wasn't methodologically terribly good. So we're currently running what we call the Oriole project. This is Olympic regeneration in East London. We'd previously run an adolescent cohort in London before the Olympics was ever even thought of, back in the early 2000s. So when East London got the Olympics, which is where our university is based, we put in to do this study based on that same school cohort, where we would try and look at whether we thought the urban regeneration that was associated with the Olympics actually had an impact on the adolescents' mental health. So before the Olympics, we recruited a cohort. It's about 3,000 adolescents aged 11 to 12, and they're drawn from 24 schools. We also interview some of their parents. And so just to show you a map of the area, the Olympic site here, this is where the Olympics that you probably saw on the telly was. This is where the stadium is and all of the other new infrastructure. This afterwards is being made into a park, and there's also student athlete housing there has been made into new housing for local residents, and that's often been assigned using a lottery system. And so we have we've described this area here as Newham. So we describe that as our sort of exposed, our intervention borough. So these people in Newham, they didn't only get this bit here that was built specifically for the Olympics. There was lots of other work done around the area, lots of new housing, lots of old areas that were probably past their best were destroyed and rebuilt. And so this area has had a huge amount of investment, all associated with the Olympics. And that is still going on. And then what we did is we chose 4 adjacent boroughs. So we've got Barking and Dagenham here, Hackney up here, and Tower Hamlets down here. And these are all of what we call our control areas. So these areas we've got children from, and we're going to compare them to the children who we've sampled in Newham. Now, when we were designing this study, it's quite complicated because obviously people who live here in Tower Hamlets, here in Hackney, also get some of the impact of the regeneration. And actually what we found is during this period of Olympic development that a lot of these areas have all had some improvements of some sort, all associated with the Olympics. But our model is based upon the fact that the people here in Newham in the middle will be getting the biggest dose of urban regeneration compared to the others. And so what we're doing is we're going to look at, we've collected baseline before the Olympics started in July 2012, and then we went back 6 months after the Olympics and then 18 months after the Olympics. So we've got a short-term follow-up of these children and a slightly longer-term follow-up. We're interested in a wide range of physical and mental health. So we've got measures of their physical activity. We get their BMI, we weigh and measure them each time we go. I'm leading on the psychological health and well-being of the children. And we've got lots of measures of sort of social determinants of health as well. And then we're using geographical information systems to derive lots of neighbourhood and environmental data for the area. For example, access to green space, we've got noise exposure, air pollution, access to fast food, walkability and things like that are all included. So for mental health, we took the approach, we're looking at 2 different sorts of mental health. We're looking at something that's been quite popular in the UK, I don't know about here, called well-being. So this is seen more as a sort of, as a psychologist, we tend to always look for people who are a bit depressed and sort of at the poorer end of the spectrum. Well-being is trying to look for people who are doing well, who are thriving, and who we think are generally sort of getting the most out of life. And so we've got measures both of sort of those people who we think are doing well, and also then we've got a measure called the short moods and feelings, which is depression. And so basically we're hypothesising that those who are living in the area receiving the greatest amount of urban regeneration will have higher well-being and lower rates of mental illness, both 6 months and 18 months after the regeneration. So this study is ongoing. We've got a website up and we're just at the minute sort of analysing the data, so hopefully we'll be able to report back soon. But I just wanted to give you a sort of example of how you try and tackle this issue in the real world when you've got something like the Olympics going on and you want to try and see how all that money that's being invested might have an influence. So then finally, I'm going to just talk briefly about some of the forays into environmental noise exposure and mental health, and trying to show a link here. So this picture here on the right, this is from one of the pressure groups around Heathrow, HayCan, and this is just a camera set up, and that's an hour's worth of planes on one particular day over that particular tower block. Again, you think, goodness, I'm not sure I'd want to live there, especially at the top. And it is really loud. The thing with Heathrow is that everything's been built up right to the edge of Heathrow. So we've done a lot of studies around schools. I can remember being at the car, getting things out the car to go into the classroom. You're talking to your co-worker, but you actually can't hear each other, even to say, could you just carry that box or take this? And so it does make you think about as well when children go outside at break time and recess, things like that, they're also sort of not getting the same experience as others. And this map here is just a map of Rotterdam. In Europe now we all have to do noise maps, so every city over a certain size has to produce maps like this. I'm sure you've seen lots of these, probably more for air pollution than noise, but just showing you where the highest noise levels are, so that you can start to try and link that to people's health. So we always say that we're noise researchers, and then people tell us off because actually, of course, we should say we look at sound. So it leads to the question, when does sound become noise? So noise generally is any unwanted sound. And for long-term exposure, we do perceive it to be a pollutant and an environmental stressor. Obviously, the meaning of the sound is really important in determining your reaction to sound. You tend to find if you're making the sound, you can't see what the other person's problem is. The unit of sound, as you probably know, is the decibel. And decibel is quite a tricky thing to work with. It's not linear. An increase of 10 decibels is really, to you, would hear about twice as loud. Okay, so a normal conversation, so me talking to you today, is probably in the sort of mid-50s to 60 decibels. A busy street, I've been waiting for some of your Vancouver buses. It's quite loud down there when you're waiting on some of those junctions. It's about 78 to 85 decibels. That's quite loud. If you were to stand 25 metres away from the runway down at Vancouver Airport, you'd be getting a really hefty dose of about 140 decibels if it was a sort of typical plane taking off. And so what we tend to do in epidemiology is it's quite difficult how you determine dose. So we tend to average these decibels up. We tend to do things like let's get a 16-hour average. So it'll be an average for the year generally between the hours of 7 and 11 in the evening. There's also other measures do the same over the nighttime period, and we also have a 24-hour measure. So does noise harm health? People are often quite surprised to hear that there's pretty good evidence. Of course, we're pretty sure we have lots of occupational laws in place to protect workers' hearing, with the proven link between those. There's also a whole host of other things. So there's good evidence for an effect of chronic environmental noise on sleep. This thing called noise annoyance, and this is what all the politicians always refer to. This is their big sort of thing. They think it covers quality of life and health and everything. So you'll often hear people say, report on noise annoyance. I'm going to talk a little bit about depression and anxiety. I've also done a lot of work on children's learning. So for example, children who go to schools exposed to a lot of aircraft noise tend to have poorer reading development, and also memory performance. And then really in the last 10 years, evidence for effects on high blood pressure and heart attacks has really increased. Quite a small effect, but a significant effect of noise on cardiovascular outcomes. And also a few studies now starting to try and look at medication. I'm going to talk quickly about one of those at the end. So one of the studies I was involved in, we were looking at whether children attending noisy schools had poorer mental health. I'll skip over that. It's called the Ranch Project, and actually Hugh came many years ago to do a sabbatical on Ranch when we were still running it back in the early 2000s. So we're basically interested in whether chronic exposure to aircraft or road traffic noise at school had an effect on children's health and cognition. And this was where this was an epidemiological study, so we ran the same study, and we had a centre in London, one in Madrid and one in Amsterdam near the airports, but we ran the identical study in all three countries, so we could then combine and pool the data so we would have better statistical power. So they were all state primary schools. I think you say elementary schools. Is that right? Both, okay. And we had schools from a range of aircraft and road noise exposures, and we modelled the noise at the schools. We basically went into the school classroom for the morning, and the children completed lots of cognitive tests of reading as well as measures of mental health. I'm just going to go quickly through this. I've got too many slides. Just to show you that we covered a whole range of things. We had reading, memory, different types of memory. We looked at noise annoyance, mental health. We measured the blood pressure in some of the children. And then the parents gave us a questionnaire, and we got a host of information on sort of socio-demographic and socio-economic factors. And so today I'm going to just quickly talk about the mental health findings. We had a measure of mental health that was sort of their overall mental health. And then we also had conduct disorder. So this is sort of antisocial behaviours that children might exhibit. Hyperactivity, and then emotional symptoms, which is sort of another way of saying sort of depressive symptoms. So we ended up with 2,800 children who were aged 9 to 10 from 89 schools. We had really good response rates. And just, I won't go too detailed here, but if we look at the all countries column, you can see we had aircraft noise exposure ranging from very quiet at 30 up to 77. And for road traffic, it was 32 up to 71 decibels. So this table has got the mean scores that we had for each country for the different mental health outcomes that we had. Just to show you that they were continuous scores. We did have differences between the countries, so the children in the Netherlands tended to score lower. A low score is sort of better mental health on this scale, a high score is poorer mental health, with the children from the UK and the Spanish children having the higher scores. And so just to quickly go through, we looked separately at the association, so we were really looking for exposure effect relationships between aircraft and road traffic noise at school in these mental health outcomes. This column shows the aircraft noise, and this is the road noise findings. As you can see, if we looked at overall mental health, we didn't see any effect of noise on that outcome. For hyperactivity, we did show that the children who had aircraft noise at school had slightly higher hyperactivity scores, but we didn't find that for road traffic noise. For conduct disorder, so this is antisocial behaviour, there was no effect of aircraft noise, but there was an effect for road traffic noise. But I should say that went in the opposite direction. So there it looked like if you were at a school with lots of road noise, you're actually less likely to have conduct disorder. So that was a bit puzzling, and so we're not very sure about that. And then for the depressive emotional symptoms, we didn't see any effect of aircraft or road traffic noise. So I'm just going to skip over the next sort of more detailed slides. And this was just the finding for reading, which actually showed a much stronger dose-response relationship. So for aircraft noise here, this is their a reading Z-score across the three countries. You can see as you go through that reading score falls below average, because 0 is the average on a Z-score, at around sort of 57 decibels. and that we found that actually for every 5 decibel change in noise exposure, your reading age was delayed by 2 months in the UK and by 1 month in the Netherlands. So if you're thinking your range of noise exposure might be 20 decibels, you could be seeing a delay of about 8 months, 4 to 8 months in the child's reading age. I'll just go to one final slide. I did also then follow up these children in the UK. After 6 years, I went back to them in secondary school. I was trying to see if we're going to see effects of having that primary school noise exposure actually stayed on for their reading and mental health later in their learning life. And so just to give a quick summary, we didn't find any effect of primary school noise exposure 6 years later on these outcomes. So children attending aircraft noise exposed primary schools did not have poorer reading or poorer psychological health 6 years later compared to their peers who had attended quieter primary schools. We also then got secondary school exposure, so another sort of cross-sectional study within this study. And actually secondary school aircraft noise exposure also wasn't associated with poorer psychological health, but there was a trend for poorer reading comprehension. And actually that effect at secondary school looked about 3 times the size that it looked when the children were in primary school. But we think that's probably because the children who got noise exposure at secondary school probably had a really high dose of noise throughout most of their schooling. And so what you might be seeing is actually the cumulative effects of having gone to a school for several years. And these children were 16 when we retested them, which was the end of schooling. So Hugh just briefly mentioned the guidelines for noise exposure. There are WHO guidelines for community noise set back in 2000. This is specifically for children. So for school playgrounds outdoors, they suggest 55 decibels outside during play, and school classrooms 35 decibel during class. Now these levels for schools are incredibly low and actually fairly, I mean, most acousticians see 35 decibels and will just, you know, they don't, it's a bit utopian. It's not very possible. 35 is really, to you and I, mostly like silence. Okay, so you want children to sit in silent rooms. But as Hugh said, we're currently revising these. I'm currently involved with a systematic review of the noise and mental health and cognitive effects literature that will feed into the group who are doing the revisions of these. So just to finish, I want to talk briefly of a study on medication use. This is a really nice study from Sarah Flood in the UK. This was another European study called the Hyena study, where they're looking at hypertension risk for adults who live near airports. I think there were 6 or 7 European countries involved in this. And then they had lists. This is self-reported medication, so it's not as good as having sort of medical data you have here. But what she did find was that people who reported using anxiolytics, there was a significant effect of having aircraft noise exposure on you taking that sort of medication. And there was also an effect of having aircraft noise exposure at night, showed a very similar association there with your anxiolytic medication. Now you might think this is the sort of medication you take if you have an anxiety disorder, but it's also prescribed quite frequently for sleep disorders. And so there's a lot of evidence that noise influences sleep. So although it does support the mental health argument, it also supports the sleep. And it's not a very sort of pure medication for only diagnosing a mental health problem, which is one of the issues. But then in contrast, Sarah had data, self-reports of taking antidepressants. And actually this didn't show any association with aircraft or road traffic noise. So just my last slide, just a few final thoughts. I think it's extremely difficult to empirically demonstrate environmental influences on mental health. Whilst intuitively we believe the physical environment seems important, it can be really difficult to convince people that there are effects there. And I think this is changing slightly, but most evidence that exists is still from cross-sectional studies, and longitudinal evidence is still quite lacking in a few areas. Some aspects of the environment have been very little studied, and I think it's important to remember that the absence of evidence doesn't mean there aren't any effects, it just means we haven't looked at it well or robustly or have been studied well. I think one challenge for the future is try to disentangle the contribution within environments of different components, and that's not something we've really got a good handle on as yet. And I think although the effect of the physical environment from the evidence we've seen might be small, they can still have quite important public health implications, because you might have quite a lot of people exposed to some of these environmental factors, and the exposure will be chronic. Thank you.
Thank you so much. It was fascinating to hear about this. I heard Hugh mention the ranch study, and I had never read any of the results or seen it, so terrific. I was particularly interested in a couple of the results you showed about the systematic review. One was that, if I'm remembering it properly, that urban living was associated with increased schizophrenia, and rural living was associated with increased suicide in men.
Yeah.
So I was wondering what that might be about. I don't even know if schizophrenia and suicide are associated. I assume they are, but maybe I'm wrong.
Yeah, they can be, but I think in these studies they've not looked at them together. I think the suicide risk for men tends to come from studies from North America and from Australia, of incredibly rural areas, dare I say, lots of the time with farmers who we know have good access. If you want to kill yourself, I hate to say it, but you have good access to different ways to kill yourself if you're, and that could just be one simple explanation as to why you see that for the men and not the women. The schizophrenia and urbanicity debate has rumbled on for a long time, and there are lots of different theories about why it might be. And in the UK, we have spent a lot of time trying to untangle the role of ethnicity, because we know certain ethnic groups have much higher risk as well for schizophrenia, and so if you've got a concentration of certain ethnicities, that might explain it. But there are some really nice Dutch studies that actually got really good residential histories on people, and they still see this effect. But in terms of what might explain it, I think we're still not really understanding it.
Hi, thank you for your talk. It was really interesting. So what I was wondering was, what were your thoughts about different metrics for measuring noise? So I'm thinking in particular about what we know, what has been shown in healthcare settings. So things like peakiness. So rather than using LEQ, using the peak exposure, has been correlated to annoyance, for instance. So
yeah, there's lots of new ways. I know the work on the Airports Commission. We're also looking now at the peak thing, as you say. We're also now starting to take actually more account of a more psychological approach. So sort of actually how many flights do people see go over them, which is a really not, is a different way of doing it. But one thing we're also starting to look at is the level that you're above for a certain amount of time. So how long are you above 70 within your sort of average and things like that. So to try and get more, the average, as we know, is not it's a bit crude in places, it's fine for others. The timings, so for example, in our school studies, we wanted daytime exposure at the school, but we're stuck with the metric that measures from 7 in the morning until 11 at night. And so then you get questions of how valid is that metric really for your sort of school day that goes from 9 until 3. But yeah, we're certainly within the noise field entertaining a lot more metrics now than we used to. A lot of the reliance on the sort of averages comes within Europe, because the European Commission demands us do those noise maps I showed you using those certain metrics. And so that's why they're quite so common, I think.
This brings to mind a report I got from a friend of mine years ago that he worked for the school board and was responsible for replacing all the windows in a school at a really busy intersection. The old single glazed with triple glazed, which really cut the noise level way down.
Yeah.
The initial reaction from the teachers was, it's too quiet now. They complained about the noise in the classroom for decades.
Yeah, I was talking to my nephew about this because I said we used to live near his school and it was quite noisy. And I said, well, what's the difference, do you think, between, having sort of a busy road or an airport or, I said, because all your friends make a real lot of noise. He said, yeah, but you can always tell them to shut up. And I wondered if that was the explanation, that actually just having some control may actually we might underestimate how important that is.
Right. Just another thought, that 35 dB for a playground, how do you shut the kids up?
I know, exactly. And I think that's why some of their guidelines, they're not required, it's not required that you sort of have those levels, but they're often cited. And there's been a huge problem with them from the beginning as being too utopian,
Well,
too low, unachievable.
Right, I think if you're within 6 feet of 2 kids, you've got noise levels over 60 decibels.
Yeah, but these guidelines are supposed to deal with the environmental noise, not the sort of noise of the children themselves. But yeah.
Okay. Yeah. Thanks.
Thanks. That was just fantastic to hear about your work. You mentioned sort of most of the evidence is based on cross-sectional studies, and I wanted to ask you about there's a handful of studies. They're actually time series studies showing links between air pollution and suicide, which I've never been able to understand or point to real flaws in them. Now, I just wondered if you had any comments on.
Yeah, it's not an area, because you probably realise that this review's a few years now out of date, but I gave it today to give a sort of overview. But I think it is interesting because we're all madly now looking at air pollution and noise pollution and linking it to a whole host of outcomes. So like I'm here visiting with Hugh looking at noise and diabetes. But the suicide thing, I don't understand it either. I don't know what the mechanism would be, because most of the, correct me if I'm wrong, but most of the air pollution effects like that seem to be sort of through inflammation and things like that. And I don't know of any pathway that would lead to that, unless it's a sort of marker for urbanicity. I mean, perhaps it's that the more air pollution you have, you might be. Yeah.
Okay, we've got a couple of online questions. One is, sorry, I might have missed a few slides of the presentation, but you may further check, consider, adjust for the potential confounding explanatory variables for mental, and psychological health, such as socioeconomic status, marital status, beliefs, etc. Can you comment on this?
In one of my studies, is that?
I think so. Yeah, these are online questions, so I don't.
Yeah, what we try and do when we look at noise, or if we look at any environment, is that we try and get a whole host of measures of other things that we think confound living in a poorer environment or living and sort of poorer mental health. So, like in Ranch, what we did across the 3 countries, and it was quite challenging, was to have exactly the same questions asked of the mothers, so that we could adjust for things like mothers' education, which we thought would influence their schooling. We had crowding in the home, whether they owned the home, whether the parents worked. And if you look at any of the Ranch findings, they're all adjusted for about 10 things, because we really wanted to make sure that we took account of various aspects in that way. I hope that answers the question.
And another question is, I think related to the fact that most of what you discussed is in Europe. Can you comment on large North American cities and any evidence from them?
Actually, a lot of the papers that are in the systematic review, I would say at least half of them are probably North American. I probably should have said that. So where we've compiled papers within the different domains, for example, like the neighbourhood violence, they're really all North American, those studies. Well, they were back then. I'm not passing any judgment. I'm just saying they were papers that did come from North America. So although it's not clear, if you do go and find the paper, and I can probably give you a copy, it's clearer in there which papers were included. I mean, that's one thing I thought writing this talk actually is it's really sort of first world problems, because what I haven't done here is look at any sort of evidence of really poor environments that you might see in the third world and effects on mental health, because there's just not a lot out there on it.
Yeah, just a thought on the rural people committing suicide, or rural men. I think they experience a high degree of social isolation in their work. You know, the typical farmer can spend 12, 14 hours a day in a
Yeah.
tractor or a combine or whatever the machine is, and he's totally isolated from everything. So, yeah, that I suspect could be a factor, right?
Yeah, because you'll be feeling, it comes back again to, like I talked a bit about social support, and actually even if you're spending a lot of your time on your own, even if you've got somebody back at home, you can still feel very isolated, as you say, and unsupported. And particularly if you've got problems, I think that's a lot of time to be spending on your own, thinking it all through, isn't it?
Yeah, exactly. And a lot of farmers do have all sorts of problems. So
Yeah,
all sorts of
exactly.
things,
It's a
right?
high risk sort of industry as well. So
Yeah,
there's
it's-
multiple reasons.
If you look at it historically, 60 or 80 years ago, farming was a very different thing, and there was large groups of people working together, so a lot more opportunity for social interaction than what there's been in the last 40, 50 years.
Yeah.
Okay, I think I saw one more online question there. Okay, sorry, I missed a few slides as well due to technical issues. Are toxic effects from sources other than air pollution being studied with respect to their effects on mental health? This includes, for example, physical toxins absorbed through touch and those which are eaten or drinking.
Not that I'm aware of, but that isn't to say that people in other areas are not looking not looking at that field, but it's not something I've done. I've always taken a healthy dislike of looking at diet at all because I think it's impossible to measure, but that's my own opinion.
Okay, I've got the whole room laughing now, and we are at the end of time, so thank you very much for a great presentation, Charlotte.